And I was asked, how has Africa defied the doomsday prediction that millions on the continent will die from coronavirus? Remember, at the beginning of the pandemic, a lot of models were being implemented to show the worst scenario that Africans are going to be affected by coronavirus. A modeling that the Imperial College of London conducted for the United Nations Economic Commission for Africa, that is forecast in April of 2020, that Africa will have recorded at least 300,000 COVID deaths by end of the year. With worst scenario predicting about 3.3 million Africans will succumb to the virus by end of 2020. Luckily, that prediction didn't come to fruition. The projection wasn't far-fetched, considering the continent has the worst, weakest health system and most dilapidated healthcare infrastructure. I remember still at the beginning of the pandemic, most of the states in Nigeria do not have functional. Most of the states in Nigeria do not have functional ICUs and no functional emergency care system to be given. Additionally, the number of doctors per capita is among the lowest in the world. Most of our doctors are traveling outside the region of Africa, giving expertise care to other parts of the world. Yet, Africa has managed to defy every rule in the data analysis book and prove logical scientific projections wrong, at least for now. We don't know what's going to happen in the future. Certainly, the continent is not out of the wood yet. The battle is not yet over, and there are chances or properties. The properties only define the deadline given to it, and it's not necessarily false with all the other parameters that we have. But when you consider that Africa has recorded about 117,411 COVID-19 cases as of last count, representing roughly about 3.9% of the global death, though it is home to about 70% of the world population, it's clear that the continent has conducted itself very well. So what are the achievements so far? How do we respond to COVID cases? One, swift government response. Even before the majority of countries in the continent recorded their first cases, everyone went on full alert. Strict control measures, including international travel restrictions, school closure, cancellation of public events, limiting of gatherings were all imposed. And a study published in The Lancet showed that about 72% of African countries rolled out their first batch of at least 5 strict COVID-19 control measures, approximately 15 days before reporting their first cases. The negative consequences on the economy were theirs, and some government met with mounting criticism that they had to overreact. I remember a lot of people were saying that our economy is going to crumble because we have closed down this nation, closed down states and what have you. But those are necessary evils that we had to live with. We only responded tactically. In a battle, when dealing with an unknown enemy, you cannot predict. You shut down to a stretch there and then fight back from a position of strength. That wasn't the case on the other continent, Europe and South America. Remember, in US, a lot of people were busy playing politics with COVID-19, if I can give an example with that. Secondly, COVID-19 was treated as a national crisis. In Nigeria, for example, the presidency, the Ministry of Health, and the NCDC went into full action with formation of national EOCs, which translated to having state EOCs. So politics was actually shelved aside just to save the nation. The same cannot be said of how things pan out in the United States, for example. A survey by Pew Research Center in July 2020 revealed that the wide gap between how Republicans and Democrats view COVID-19 threat to health system was very alarming. Mind you, the extent to which people saw COVID-19 as a threat informs the likelihood that they will adhere to safety protocol, including wearing of masks and social distancing or staying at home. Even though we had pockets of politicians not aligning with the FG stand on COVID-19, but a lot of people actually came on board and supported the measures by the federal government. The survey revealed that while 85% of people who lean so democratic, saw coronavirus as a major threat to health of the US population, only 46% of Republicans held the same view. About 45% of Republicans leaners show it only as a minor threat. So this kind of non-agreement among the major players in the United States actually brings about a lot of delay in trying to save lives. As Dr. Sandro Galli, dean of the Boston University School of Public Health, said in an interview with 538.com, he said, and I quote, "The national conversation about how we behave during this pandemic has been so colored by partisan divide that it's becoming impossible to talk rationally about the risks we are and are not willing to tolerate." So COVID-19 was a political issue in Africa as well. Political opponents use it to use the pandemic to tear each other down and score some political points. We have similar episodes and issues here in Nigeria, which actually pans out to affect our COVID response. But when it came to choice between scoring political points and saving lives, most African countries choose the latter. So we all came together to save life. In Ghana, if a new law giving the president of the republic enhanced powers to enforce restriction was falsely challenged by the political opponent, employing every imaginary tactics, but in the end, they allowed it to pass so that the government could maintain control. Thus far, fewer than 800 people have died from COVID-19 in the country, about 30 million people, according to official count. Thirdly, the African leaders lead from the front. In Nigeria, the Secretary to the federal government, Mr. Boss Mustafa, head the federal government COVID-19 response team with the ministers and the other agency in his cabinet, in his committee. Well, the state governors or the deputies head the state, EOC, and then the COVID-19 team in most of the states. So also many leaders on African continent lead their nation through the fight against the pandemic as expected for the leader. The National RRT was formed, comprising of NCDC staff, which are graduate and resident of the Nigerian Field Epidemiology and Laboratory Training Program. This provided technical and logistical support at the state and then the sub-state level. These people actually help with their knowledge gathered during the Ebola epidemics, and some other Lassa outbreaks that we have in Nigeria. Did not lead from behind. Leaders publicly supported measures by health officials to slow the spread of the virus, even if they disagree with the tactics being used. So still we're not getting mixed messages. They are not encouraged to defy public health advice. Rather, they are actually encouraged to adhere to those advices. And that obviously helps in trying to limit infection and the spread of infection. Africa's COVID-19 response was better coordinated compared to all other countries. In the US, hundreds of skirmishes occur across the country as local, state, and federal entities disagree on plans for response. I remember a lot of back and forth between the federal government and the state governments were all taking place all over the place. In just one example, the Democratic mayor of Atlanta, Georgia, was sued by the Republican governor after imposing restrictions on businesses and mandating mask use. In terms of peace and tranquility, this is evidence of how great democracy should function. But in terms of war and pandemic, such fights are distraction. In Africa, when the president directs, everyone falls in line. And that can be negative because presidents sometimes get it wrong. But it seems like that has been key to helping African remain on focus. And this can be as a result of multiple epidemics we have had in the past. Another novel way that we use in treating most of our cases is the issue of home care management. Remember, at a stage we are having too many people that our facilities, our hospitals cannot take care of. So we have to devise a way of treating those people that are positive, but they are not symptomatic, so that they can get the best of care and limit infection to a minimum. Nigeria states we are facing critical challenges as number of cases continue to increase, as I've said this earlier. So hence we introduce the home care management. Infrastructural development, because of the pandemic, both the federal and state governments were compelled to increase spending on health sector. Many say that we are not having functional intensive care units. At the end of it, they had functional intensive care units. High intensity units were also created, and many centers were equipped with ventilators and what have you. And then other partners, WHO, UNICEF, NCDC, Life Care Program, other partners spent billions in manpower development, technical support, and even materials to cushion the effect of the pandemic. The seven most important thing that we did was actually having development of health regulation and laws. Some of the states have had their joint external evaluation to meet the standard minimum requirement for epidemic response. For example, Kano and Kaduna State have actually had their review public health laws to cater for the emerging and emerging diseases. Now we are forced to work in tandem with other Ministry of Agri and Environment, so as to be able to control epidemics. As a result, we can say that currently we have the minimum number of cases of cholera epidemics, and polio, unlike what we usually have previously. So states are also producing their emergency response plans to try as much as possible to curtail the epidemic response, and whenever they occur, what and where, the process to take to prevent those epidemics.
Dr. Waziri?
Yes.
Okay, you're concluding. Thank you.
Yes, I'm concluding. In conclusion, Nigeria responded quickly and forcefully to COVID-19, building on its pre-existing preparedness for the epidemics and taking notes from other regions of the world. The initial response of the nation include prompt activation of the national EOCs at the NCDC, and formation of the multi-sectoral COVID-19 response team from all other states. To significantly scale off COVID-19 diagnostic centers across all the nation, across the width and breadth of Nigeria, many laboratories were also established with the additional input from private laboratory owners, so that we can increase our testing capacity. I think that's the end of my presentation. Thank you very much. I really appreciate this gathering. Thank you.
Okay, thank you so much, Dr. Garba Waziri. That was an insightful presentation. And the audience have dropped questions in the question and answer section, with quite a number of commendations dropped in the chat box. Thank you so much. So Dr. Waziri, I understand you actually want to take your leave, so we would like to take your questions first before the second speaker. Meanwhile, participants can still drop their question in the question and answer box so that we can actually ask, but we have some questions here for Dr. Waziri. Can I go ahead, sir? Dr. Waziri, are you there? Am I being heard?
Yes, you can be heard, but maybe he's muted, so we need to unmute probably.
Dr. Waziri, can I go ahead to ask and to read out the question?
Please, thank you. I didn't know that I muted myself.
Oh, okay, okay. So the first question I have here says that with the opening of communities and social activities and the resumption of essential activities, how can Nigeria prevent incurring
Sorry, I didn't get the concluding part of your question.
I think she has issues with her network.
Okay.
So I don't know the question she wanted to ask, but I have a question, sir, if I may, before
Yes,
she comes
please.
back. There is something, I don't know if you have, I haven't seen it given it emphasis, but I think especially in Nigeria, I am afraid if we have a pandemic that will be deadly. Because as we've seen in the initial stages of COVID-19, when people really were skeptical about the pandemic, they were not really responding until they were forced to stay back. But now that we have seen that COVID-19, what people may consider as not being serious, I mean, in Nigeria especially, people were like, it's not serious, that thing. What happened? What do you think Nigeria should do if in the future we may have a pandemic that will be deadly? I think it's going to be a little bit tricky because of what happened with COVID, don't you think?
Yeah, yes, actually, you know, during that pandemic, I was in Kano, and I noticed that a lot of people do not take the pandemic very serious. But what I realized is that they are only seeing the pandemic through the eyes of what they are seeing currently happening to Nigerians, meaning that they are not seeing many cases dying. They are not seeing many cases falling ill. And most of the cases that I have admitted in my own facility, they are healthy people that we are only keeping them and giving them food, but they are positive, by the way. So basically, they are even taking videos of themselves saying that this is all political gambit and stuff like that. But then at the end of it all, we have to start doing a lot of orientation over the media. That brought about a lot of awareness among the other people. Then it down on them that at the first, second, third week of the pandemic, if you remember in Kano, we had some undiagnosed number of deaths that occurs within that time.
Yes.
A lot of people were just dying without any knowing cause. So then that reinforced the fear of the pandemic in them. That reinforced the fear that this pandemic is getting serious. Then by the end of the first, second month, when the cases mounted and then the symptomatic cases were coming up, news was all over the town that no, this is something that we should take serious. Because prominent people are coming down with disease that they need ventilators, we have to ventilate them, we have to keep them in ICUs and stuff like that. So you see, with the trend of event, initially it was just kind of apprehension, they don't believe it. But later when they are seeing the number of deaths rising, they started believing it. Then when they start hearing that a lot of prominent people were on admission, on ICU, then people started, okay, yeah, this is something that we should take serious. I think with this knowledge, a lot of people are going to kind of, next time, they will actually take government much more serious. Then the other aspect to it is that the government and the people have to be, okay, the government and people have to be very, very kind of up and about in the sense that whenever we see one case, we should follow it up and then look for other similar cases like that. Case detection is the key here. If we are very good at case detection, we are actually going to achieve a lot. We're in a third world country where treatment and waiting till case blown out of proportion is not going to augur well for us. The best thing that we can do is prevent. Prevention, prevention, prevention. That's just the way to go about it, sir. Thank you.
Thank you very much. Thank you very much. If I may add, I don't know if in the participants there is anybody who wants to ask. If not, then I can ask one more question, then we can maybe allow you to take your leave. Anybody from participants, you can raise your hand or you can unmute yourself and ask your question. So another thing that I would probably would like to maybe discuss is the concept of low-level viral exposure and protective immunity. I mean, some people think they are invisible. I think if I may add a little bit about what protective immunity means in viral pandemic, and whether just because you are immune, you don't get sick, it means that you shouldn't follow the protocols. I think is that something you can add on that, please?
Yes, unfortunately, we Africans, we have this sense of being like extra human beings, that these diseases are not affecting us in the way. We are lucky this time around, but I don't think next time we're going to be much more luckier than this, honestly. I was a victim of COVID, I remember, and I was busy going around treating other people with COVID, even though I was infected in the hospital. I was on admission too. So I also had that kind of sense that maybe this thing will just pass over. But then I came down with COVID. I realized that no, I have nothing to hold on to except to just try to be healthy. Seriously, we need to do well on our dissemination of information, telling people that no, Africans are not superhumans. And the fact that you have had cold previously doesn't mean that you can't come down with COVID or any other respiratory infections.
Thank you very much, Doctor. I think
answered your question, sir.
Yes. Thank you very much. I think I know you are busy. We can allow you to take your leave.
Thank you.
Anyway, if anybody has any questions for you, we will jot them down, we'll email them to you, and if you answer them, we can send them the answers through their email. I think there is one comment by Adelu and Dr. He's a member of Nigerian Academy. He was just thanking. I say it's an insightful delivery. So he's just thanking you for the presentation. Thank you very much, Doctor.
I really appreciate it. Thank you, sir.
Thank you. I think Dr. Mutiar is back, so you can continue. Dr. Sogbanmu.
Yes, I'm back. Thank you. I had some internet connection issue.
Okay.
So can I be allowed to share my screen now? Because
yes.
I am not allowed to get the video on, so I'm told. I cannot start the video and I cannot share my screen. Okay, I can share my screen. Let's see. Is that right? Let me just share my screen so I can introduce the second speaker.
Okay.
Thank you very much, Dr. Waziri. We appreciate your invite. Are you coming? Sorry. Okay, sorry.
Yeah, we can see your screen.
Okay. Oh, so that was the program of activity and Dr. Waziri. So I would like to introduce the second speaker in person of Dr. Temitope Sogbanmu. So Dr. Sogbanmu is an environmental toxicologist with several years of experience in risk assessment and management of organic pollutants in various matrices. This is with a view to developing and providing targeted environmental management advice to regulators, industry and practitioners, as well as policymakers. She is the founder and lead evidence use in environmental policymaking in Nigerian project, through which she engages various stakeholders, including policymakers, indigenous communities, industry practitioners, and researchers in the environmental evidence ecosystem to facilitate evidence-informed decision-making. Dr. Sogbanmu is a serial multiple award and grant-winning scholar in environmental research, evidence leadership, science advice, communication, and policy. Notably, she is the 2022 winner, African Evidence Leadership Award Intermediary, Grantee Evidence Leaders Africa in 2020, Science Advice for Policy Fellowship by the African Academy of Science 2019, among others. She is an ardent researcher with several publications, editor, board member of international peer-reviewed journals, affiliate of the African Academy of Science, the vice president, Nigerian Young Academy, and advisory board member of One Health and Development Initiative. Dr. Sogbanmu is an advocate of the United Nations Sustainable Development Goals African Union Agenda 2063, Evidence for Policy, Science, and Risk Communication. She holds a doctorate degree in environmental toxicology and pollution management from the University of Lagos, where she lectures and leads the Environmental Evidence Synthesis and Knowledge Translation Research Group. Dr. Sogbanmu, thank you very much for joining us. You are most welcome to the floor.
Thank you very much, Dr. Mutia, for the invite. And thanks a lot to the Nigerian Young Academy webinar team for facilitating this. Please, if I could be unable to share my screen, I will be able to share my slides and start the discussion. Thank you. All right, good morning. Well, it's good afternoon, my end actually. But good morning, good afternoon, or good evening to all our guests, members, as well as participants from all over the world. As I've been rightly introduced, I'm Temitope Sogbanmu, and I've been invited to speak on this topic. How do we prevent the next pandemic? And what is the role of Young Academy? And just to put a caveat very quickly, that I am not an expert in infectious diseases or pandemics, but I've been invited because of my role in implementing the Mother COVID-19 grant within the Young Academy, of which I'm also an expert. So I'm going to be speaking from those perspectives, but also from my perspectives as someone who has been working, training and doing, having experience, really field experience in the area of science communication, science policy, and science advice, which we will agree with me has been most critical in curbing the debilitating effects of the COVID-19 pandemic, right from the onset of the pandemic itself, even up to this very moment. Just to mention here that the views I will be sharing in these presentations are all personal, except where I reference sources. And so they're not necessarily representatives of the Nigerian Young Academy's views, even though I'm a member and also an expert of the Academy, but it's not necessarily representative of the views of the NYA on the role of young academies in preventing the next pandemic. I'll be guided by this outline. I'm going to start off with an introduction. And here I just want to give an overview, very short one indeed, about what pandemic is, what young academies are versus young academics. And then I will go ahead to talk about pandemics and the future, then talk about what the general rules of young academies are, and then I would end up with the topic for this presentation, the rules of young academies in the next. Just to say quickly that pandemics are actually the very last stage of debilitating health conditions, which starts from an health condition that could be endemic in that it's only observable amongst a particular population, but at a steady rate. And then from endemicity, it can actually move to becoming an outbreak, at which point this has gone beyond endemic levels. And from being outbreaks, you can have health conditions going into becoming epidemics. From outbreaks to becoming epidemics. In that instance, the outbreak or the disease spreads over a very large geographic area. And then in this very case that we're talking about, the coronavirus pandemic 2019, then it can become an epidemic in an instance where the disease has spread globally, not just across a particular region or country, but indeed across regions and countries all over the world significantly. And so a pandemic really is an epidemic that has spread globally across the world. So what are young academies? Knowing what a young academy is, because I'm a member of one, I just decided to do more literature review on it and see what I hope you can hear me. Yeah. So young academics may be regarded as formal organizations. Usually they would have designated leadership, but one characteristic of young academies, like other academics, we call senior academies, is that they are composed of outstanding, distinguished top faculties. And most times in academies, as we have in the Nigerian Young Academy, faculties or scholars, especially in the area of research. But that could also be combined with teaching. That's for those of us who are lecturers. But we don't only have lecturers in young academies. We have people who work in research institutions, in which case their work is basically research focused only. We also have people who work in government institutions who may become. So their main aim or the main outstanding factor for their becoming part of the academy is their contribution to the field of research. And another thing is that they are often young. So by the definition of young, for instance, in the young academy, will be age for men between 40 years maximum and below. And for females, they will be 45 years maximum or below. And like the young academy again, often they would have completed doctoral studies, but this is not always the case. Sometimes the minimum really is a master's degree, but with significant research and contributions to the field. And the whole purpose of these organization of outstanding faculty is to enhance the mission of those academics for which they have joined. For instance, in the Nigerian Young Academy, our tenets are research, excellence, and integrity. So we expect that faculties, scholars who are inducted into these young academy exemplify these tenets and carry on that mission and vision. With the end goal of impacting their society, and I talk about impacting the world using their science and their evidence. Then we talk about young academics. So young academics can sometimes be called junior academics or early career researchers. People have often categorized that from 3 to 5 years post PhD. Some go as maximum of between 0 to 10 years post PhD. But the main thing here is that they are academics that are transitioning from just completing doctoral research into becoming independent researchers themselves, independent thought leaders themselves. Now, so in the context of the future, how can we talk about pandemic? Again, I did some literature and I found out that we've actually experienced some very deadly pandemics in the past. In fact, in the past that a lot of us in this generation did not experience. And as we know, it's good for us to have a good knowledge of, I don't know, the first place, I don't know where the sound is coming from. Yeah, it's good for us to have a very good knowledge of history in order to be able to provide context for what we should expect in the future. Now, so we've had several pandemics going from Black Death, which actually caused death of about 200 million people, up to smallpox, Spanish flu, influenza, COVID-19 pandemic, Russia flu. But one thing I realized with all of these pandemics is that all of them were actually brought about by microorganisms, particularly viruses. And then they were further spread through vectors. And my concern is that when we talk about the future of pandemics, does that mean that we need to focus on virology and the study of viruses that has a capacity to bring about this type of debilitating effects on human health across the world? Yes and no, because as we will see on the vectors, I'm a zoologist, by the way, quite a number of the vectors are actually not animals. They are also carried through or spread through environmental matrices. They spread through air, through water, through touch. It can even be through, land sources, soil, maybe contamination through food or thereabout. So it means that when we talk about the biology in terms of the organism, the pathogen that causes the disease itself, we cannot disengage or remove the factor or the contact or the way or the transmission route of these organisms to other human populations and indeed other organisms within the ecosystem. And so in that context and from an environmental point of view, I feel strongly that when we talk about pandemics and the future, we need to talk about it holistically. And one of the greatest environmental challenges that we're experiencing in this current century is climate change. And I'm sure everyone, including those who are not learned, will appreciate that indeed the world is facing unprecedented changes in climate. We're experiencing changes in seasons and weather patterns, extreme in some locations, really bad things to like flooding, heat waves across Africa, even right here in Nigeria, we're experiencing it. And this is affecting different socioeconomic aspects of man and life as we know it, from food security to economic stability of all nations and all regions. And so I checked this paper and it says, indeed, climate change may actually make pandemics become more. And one of the important things to think about when we look at climate change is that when these changes in climate and in the atmospheric conditions of climate variables, things like temperature, things like pH, organisms from our study of zoology have tolerance range. And so when the tolerance range becomes exceeded, it can affect their biology and it can affect the routine way they work. Might it be that the impact of climate change, if it continues the way it's going, without abatement, without mitigation, they actually influence the distribution, the biology, the patterning of vectors of potential disease-causing organisms and even the disease-causing organisms themselves. These are things that we should talk about and we should continue to think about as we look at the future. So what are the roles of young academies? Young academies, like I said, they're composed of top outstanding young scientists and scholars across national, like the Nigerian Young Academies, regional, the African Young Academy of Sciences, the affiliate group, global, like Global Young Academy. And one of the key aims or roles of young academies is that they want to ensure their voices are heard. And that's why when we talk about young academies, we are talking about a group of people. The truth is that even senior academics, our voices often are not being able to be heard when we talk alone or as individuals. But when we have an agglomeration of outstanding scholars and scientists, we are able to prefer and give a voice to things that we believe can change paradigm, either through science or in science, but also in society. Remember that I had said that one of the aims of Young Academies is that we want to impact our society positively using research or evidence. So they get their voices heard by leaders at political and academic communities, decision makers, get their voices heard through to legislative authorities, sponsors, business leaders, media. And one of the ways they can do that, and they do that, is they facilitate open science, open data. They can also support or give voice to issues like I talked about climate change and the issue of biodiversity loss. And of course, within this context, also COVID-19 and pandemics, give a voice to issues around global health. And now we'll talk about One Health. One Health in the context of looking at the holistic interfaces and matrix from environmental to animal to man and all the things that go in between. Another role of Young Academies is that they inspire or mentor next generation science. We do that a lot in the Nigerian Young Academy, and this is often reminiscent of what Young Academies do. Remember, they are outstanding scholars, so they're supposed to be a beacon of hope to upcoming budding scientists who are looking to come into the field of science and pursuing a career in science. And how do we do this? We do that through science communication, through facilitating grant writing workshops. For instance, at the just concluded NYA conference, we facilitated a 2-day anti-plagiarism workshop, seminars for individual counseling, advice, and mentoring schemes. Now, comes to the question, knowing the roles of Young Academies, how can Young Academies support to prevent the next pandemic? Now, what I've done is to document some thought or perspectives in my own experience and some from literature as well. Like I said, in implementing the Mother COVID-19 and COVID-19 in Africa project, which the NYA is just completing. And one of the aspects that I handled was to curate and seek expertise for people to document their experiences and provide policy piece for us in how COVID-19 was approached in terms of reducing its impact, particularly in Africa. And in the course of that, I had the opportunity to interface with not only senior academics, but also with other young academics, as we would have seen in our webinar series, which are also partners in this project. And one of our own objectives too with this project, I've realized that there is need for us to have documentation of expertise and scholars within young academies. But it's not only the documentation, because these documentations are available, but that this documentation should be publicized. They should become visible to the world at both local, regional, and global levels. And here is the reason why I talk about this. Most of the time, when governments at local and international level are looking for experts, maybe to join committees or to be part of programs to implement policies or to engage communities, they seek out leadership of academies. And sometimes young academies are left out because they don't realize that they are actually young academies. But when we have these visibilities of scholars that are out there, openly accessible to anyone. I have had people reach out and say, we're looking for experts in this area, particularly from the global south. That's one challenge we have. So maybe I can even make this a bit, peculiar to scholars and expertise of young academics within young academies in the global south. There is need for that documentation and visibility to happen across all disciplines, both from core fundamental science up onto areas in social sciences and the humanities. Another area I feel we should look into as young academies and roles that we can play in preventing the next pandemic is that we need to identify and facilitate acquisition. and access to human and material resources. Thankfully, the Nigerian Young Academy has within this project documented equipment, instruments, resources that are available across institutions in Nigeria. And we aim to actually make those equipment and instruments available open access on the NYA website, so that when capacities or equipment are required by various institutions or persons working in different areas, particularly those ones that are very high-end, cutting-edge or expensive, where one institution or one individual is unable to, secure on his own, there would be opportunity to actually share knowledge and resource in that area. And that the particular thing is that this resource and capacities can be shared within local and even regional levels. We don't have to travel all the way to the global north in order to do basic molecular studies, for instance. So one of the ways that young academics can support with that, just like the NYA is doing, and I think some other academics are doing, but we need more effort in this area. And not just the material resources, but also the human resources as well, human resource capacities. We have discovered in the course of implementing this project that there are some of us who actually have cutting-edge expertise that can actually help to support implementation efforts or mitigation efforts on global health issues like this within the young academy. But if we look at the national ministerial committees that have been set up or currently being set up with reference to global health issues, hardly we will find young academies there or young academics there. So we need to put ourselves forward. If people don't realize we have the expertise and experience, nobody will call upon us. And I'll come to talking about how we can put ourselves also before government in the area of science advance. Investment in capacity and promotion of risk communication. I think this was one of the very big challenges I had at the onset of the pandemic. Should I say I was unfortunate? At the onset of the pandemic in early 2020, or rather the global lockdown, I had just gotten the TWAS DFG Corporation Visit Fellowship, and I traveled to Germany, and I was right in Hackney, which was the center of the COVID-19 outbreak in Germany at that time. And I saw firsthand the efforts that were ongoing within the country. And here I was in Germany at the time, but Nigeria at that same time was still grappling with whether it should implement a global lockdown or not. And it was still taking stock of what strategies to implement. The other challenge that Nigeria was also having at that time is communicating the risks to its population. And this risk communication was actually quite haphazard. It was a state of nobody really knew what to do or how to communicate. And so it's something that we need to realize if we're going to prevent the next pandemic, that there is need for intentional investment and intentional training in risk communication, not only for global health professionals, but across all disciplines. And so we cannot exclude expertise or disciplines like social sciences, mass communication, humanities, in risk communication training and in advocacy, strategic communications. One of the key populations that was difficult to communicate to were those that were in rural communities, those that did not understand all that we were communicating in English language only. And so for me, one of the things I was pushing the academy, which ended up happening then, was that we need to break down our publicities through policy briefs and infographics to our main local languages in Nigeria. That way, we can actually reach the common man who necessarily cannot read the English that we are writing, even when we break it down to simple English. The man in the village, my grandma, cannot read in English. And so when you are communicating risks to her, wear your nose masks, keep social distance, she doesn't understand what you're saying. And I will not have the opportunity to talk to her. And so if one of the avenues she has the material like this, or communication through TV and radio, then it needs to be in our main local languages. So we need to invest in that, not only in language, but also in the approach in communication, using graphic. We've achieved that a bit within the Nigerian Young Academy through the dissemination of policy briefs, brief summary of core issues, core recommendations, core evidence or research findings on specific subjects with respect to COVID-19. All synthesis from usually large cohorts of studies, but summarized in 1 page or 2 pages and easily accessible and utilizable by decision makers. We need, as global academies, young academies, to support local to global institutions and community engagement strategies. The truth is that we cannot leave it to governments alone, both at local, regional, and international levels. Because as we saw with the COVID-19 pandemic, God forbid when the next pandemic strikes, it's going to cut across everyone, and not only those in government, even though they are the ones that make decisions. And so we need, as young academies and as people who are experienced in 21st century technologies and 21st century approaches, to support to facilitate community engagement, to boost confidence in public health. That is one of the issues that was battled with in mitigating or reducing the effects of COVID-19 pandemic. Young academies need to support in leading this type of community engagement strategies, and not only engagement of multidisciplinary and transdisciplinary teams. I already talked about involving science, non-science, social sciences, humanities. But when we're talking about transdisciplinary and disciplinary teams, we're even cutting across those in core research. We're talking about reaching out to people in community-based organizations, civil societies, and NGOs. I'm sure we will agree with me that these CBOs and NGOs were very critical in supporting advocacy, community engagement, and even in risk communication within the present or outgoing COVID-19 pandemic. As young academies, we need to engage such collaborations and approaches in research with such societies and institutions, in order to support and facilitate evidence-informed decision-making by the policymakers across local to regional scales. We cannot limit our engagement to just within ourselves as young academics or top scholars within academics at local and regional levels. We need to promote and reach out to the society which we aim or which we have the mission to impact, to engage them in research. We need to facilitate training and mentorship opportunities in science advice. Through the Young Academy, I was nominated to be part of a science advice skills development program, an inaugural program of the International Network for Government Science Advice. And even though I've been working in this field in recent years, I realized that I needed more training in this. We need to facilitate such training. We need to ensure that young academies are not only made up of scholars who understand their science and know their science, but we need to be able to get engagement and training, which we don't get formally within our institutions or within our labs, to be able to communicate our science and provide science advice to government and ministries and agencies at all levels. I can tell you, ladies and gentlemen, a lot of the engagements that I have had in recent years have not only just been my science and my publications, it has really been my science policy engagements and fellowships that I have had with ministries, with NGOs at both local and international levels. And I have, through those singular opportunities, been invited at local and international levels to speak from the point of view of a young person who is able to communicate and provide scientific advice to ministries and governments, including multilateral institutions. We need this specific training, and young academies actually have a place to be able to facilitate and promote such training. It's not something that an individual can take out to do alone. We need mentorship opportunities. We need opportunities for secondments, for instance, on providing science advice. Another thing we need is cooperation between academics and sync with senior academics. Thankfully, within the NYA, we enjoy cooperation and mentorship from the National Academy of Science. I don't know if this is the same way with other young academics, but we need such sync and cooperation. But not only with senior academics, but also amongst and between young academics all over the world. And this needs to be improved upon. It was exemplified with this COVID-19. We need to promote open access, data sharing, utilization of cutting-edge technologies, particularly accessible to young scholars. And why did I identify young scholars? Because most of the time, young scholars are the ones who know and have the capacity to be able to take up cutting-edge or new technologies and apply them because of fresh brains, because of energy that we have. We can deploy this in solving global problems, including preventing a potential or next pandemic. And so with that, ladies and gentlemen, I hope I've been able to share my own perspectives and thoughts on what I feel the roles of young academics should be in preventing the next pandemic. These are my references. And I just want to acknowledge the NYA, the NAS, and the Center for Interdisciplinary Research at the University of Bielefeld. I'll be going on a science advice research fellowship where I'll be looking at the interface of pandemics and how philosophy can help in information and misinformation and how to provide science advice. I've learned a lot of the presentations I've had there have been for my contributions and the things that I've heard and I've learned within the research. Thank you very much for your attention.
Thank you very much, Dr. Sogbanmu. That was a wonderful presentation. We thank you for honoring us. Thank you so much. Once again, I would like to thank the panelists for the comprehensive presentation. So we would have the question and answer feature is there for anyone that wants to ask Dr. Sogbanmu any question based on what she has presented. But Dr. Sogbanmu, I have a question here that says that you mentioned open science and open data as a means of getting your voices heard to decision makers or legislative authority. Can you please throw more light on that? Just for clarity, for those of us that are not in research, just put in a layman terms for us to understand.
Yes, thank you very much. Let me use the example of a portal which I lead. It's called the Environmental Evidence Portal for Nigeria. Like I said, in my engagements with policymakers and decision makers, one of the challenges that they've had with us scientists is that a lot of the information we have, which is indeed important and which they need to help inform their decisions or policies, are often stored up in papers that are not openly accessible. So they have to pay for it, they are behind paywalls, or they are stored in our libraries in our institutions. And so they cannot access it. They have to come all the way here, and decision makers will not leave their offices to come to your institutions to request it. And so if we really want to have the kind of impact that we want to see, and we want to change our world, then we need to promote and facilitate open access. Open access means that everyone can access the information or the data. But it's not just providing the information or data, because it can be out there and people don't understand it. It's only understandable by scientists like ourselves. And that's why I talked about training in science advice, training in risk communication. We have to be able to break it down, put it in graphics forms, for instance. Explain it, explain all your graph and all your trend using just one line or one picture, what that is saying. And so, for instance, with the Environmental Evidence Portal, what we do with that is that we provide a one-stop shop where people can get information on anything that has to do with environment with respect to Nigeria. But our long-term aim is that we want to be able to ensure that the data and information presented there are things that are accessible, particularly using graphics, So anyone from young people to non-scientists can see what the story of your 100-paper publication or thesis is saying, and use that to be able to make a decision within often a short period of time, without having to go through a lot of engagement or even reaching out to you. They may reach out to you, but it doesn't have to be too detailed, such as too complex that they don't understand what that data is saying. So that's what we mean when we talk about open access, in terms of let it be openly accessible, but also let it be in the form where people can use it and they can make decisions with it. It's something that requires effort, it requires money, it requires a lot of funding, but it also requires intentionality and a will to do that. That way we can really make more impact.
So I think that should also be part of the training to be given to the people that actually gather the data, because it's a different thing you performing the experiment, putting up the data, probably in writing in form of manuscript or in form of publication. Now put it in a simple language, probably in a graphical way.
Yeah.
That actually is a training on its own.
Yeah.
Which I think our academic can actually be involved in, since we are talking about trying to communicate our science to the policy, to the decision makers.
Yes.
So I don't know, as the Vice President of Nigerian Young Academy, is there anything in place for such training? For at least we can start with members of the academy before we can escalate to probably other young academics, those in academies but are not academic.
Yes, thank you very much. I think in recent times, or maybe it's the University of Lagos that facilitates that, there is a media communication company, it's called The Conversation, and I think The Conversation Africa, where they actually have an open source and even workshops, virtual workshops on science communication and science writing for communication through op-eds, like opinion, like blogs, newspaper articles, for instance. There are actually workshops like that that are available and they are free. And right now they have partnerships with institutions. I think the NYA has done that recently in collaboration with NAS. We hope that we'll be able to do that, more of that, more. And even our president is an alumni of the African Science Literacy Program. And one of the things they also facilitate is science communication workshops. So we hope to do more of that. And we facilitated some of that within our implementation of the Mother COVID-19 project. As you will see, all the policy briefs that we disseminated and infographics were all graphical and they were simple to understand, not only by core scientists, but by the common man. And so the key messages were accessible and understandable by all. We hope to continue to be able to do that. It's work in progress. We are not there yet, but we will continue to do more.
Okay. Thank you so much, Dr. Sogbanmu. I guess there's no question here, and we are almost running out of time. Thank you so much. That was highly insightful. So I would like to conclude by calling on the NYA Webinar Committee Chairman, in person of Dr. Muritala Isa, to give the vote of thanks. Dr. Isa, the floor is open for you.
Thank you so much, Dr. Mutia. You did a really good job. And thank you, Dr. Sogbanmu. Thank you very much. It's always nice to have Dr. Sogbanmu to talk, because you know that she's going to electrify the discussion. Thank you very much for accepting to be part of us. And I hope that the Academy will take note of your recommendations, and being the Vice President, I think implementation should not be a problem, because you are part of the people who are making the rules. So we hope that the Young Academy and the sister Young Academies will take your recommendations into account. I would like to, first of all, thank the participants, because I always like to start with them, because without them, then there is no webinar. I mean, we are trying to reach to them and they are responding. Briefly, I would like to mention what happened, because this is the last webinar of the series that we are having. So far, we have conducted 9 of these webinars delivered by 20 different speakers from January to September, including today, we had 22 different speakers, 22 different topics throughout the webinar that we had. Then 12 of these were affiliated to Nigerian institutions, while the remaining 8 of the last 20 were international researchers. 6 of the locally affiliated researchers were from academia, 4 from government parastatals, and 2 were in private sector. The topics that we covered were all related to the pandemic, but we approached them from varying angles. The domains that we touched include local vaccine production, effective response strategies, communication, mental health impact, natural product as a solution, mathematical modeling, open source initiative, geospatial analysis. These are all topics that we think were adequately covered in the series. And if you follow the series, because we have the videos on our YouTube channel, you go and review them, you see that there's a massive amount of information relating to the pandemic, which we covered in the series because of the caliber of the experts that we had. Actually, 3 of these webinars were delivered in French language in collaboration with the Beninese Young Academy. And one of the webinars were translated live into English, and we had a participant from Nigeria joining the French-speaking sister academy. And so many ideas were shared, and the recording of the video recordings of these webinars are available on our YouTube channel, which I think I've already shared a link for today's webinar. You can follow the same live Nigerian Academy on YouTube if you want to review the webinars that we did. Throughout the series, our average registrants reached 100, and we usually have up to 50 attendees per webinar, which like I said, we really appreciate the participation. We really appreciate, we hope that in our next webinar in 2023, we are going to see more of you. This will be the end of the COVID-19 series. In 2023, we are going to bring new and novel areas, which we are going to explore, which we hope that you are going to be with us. I would like to thank all the speakers. There are so many of them, 22 speakers who made this possible. We really, really appreciate this. My team, the NYA Webinar Committee, Dr. Mutia, Dr. Franklin, Dr. Isaac, and Dr. Anjori. Without you, it's never going to be possible. You're always there. You really acted promptly when you are needed, and the webinar has been a massive success. I would really can say that it's a massive success, and we hope that the Academy will continue to be cohesive and produce these kind of symposia where intellectuals are invited and there's discussion happening, and there's communication with participants that come from academia, industry, and even students. I can see that there are students, undergraduate students who are joining, and it seems that they are actually also enjoying this series. Conclusively, the President of Nigerian Academy, I would like to also appreciate you for giving us the mandate, and we hope that we have reached your expectation. I'll see you, with this, I'll say that we'll see you next year. I think the first quarter of next year, we are going to have a webinar, and probably after that, it's going to be a quarterly event. This is not going to be a marathon anymore. Thank you very much. I appreciate you, Dr. Mutia, and I appreciate all the participants and the speakers. Dr. Sogbanmu, thank you very much, and God bless everybody.
Thank you, everyone. Thank you, Dr. Issa. Thank you as well. Thank you to all attendees. We appreciate you being connected to us. Thank you so much. We'll see you next year. Thank you all.
Yeah, Dr. Mutia, thank you very much.
Dr. Isa, thank you. Thank you so much. I appreciate your support. Till next year, we are done with the webinars.
This year, yes. Yeah, so next year, we will begin in the first quarter of next year.
Oh,
thank you.
First quarter?
Yes.
Is it still going to be the same team, or there will be like a review?
No, it's definitely going to be a different domain, entirely different.
Different team,
Abi?
Exactly.
Different emphasis.
They should give us another assignment, I beg.